let's define this medical condition. Chronic rhinosinusitis is diagnosed when you have sinus inflammation for 12 weeks or more. And nasal polyps are small bilateral noncancerous growths that occur from the inflammation in the nasal passages and the sinuses. Now, signs and symptoms that you have this condition include loss of sense of smell. Many times we see nasal congestion, runny nose, postnasal drip, facial pressure, or sometimes pain in the upper teeth, and very commonly our patients complain of snoring. Now, a diagnosis of this condition is usually confirmed with nasal endoscopy. And this is a procedure done in the office where a thin, flexible tube with a camera is placed in the nose to look at the sinuses, or we can look at the sinuses by CT scan. Many patients with this condition also have significant allergies and can have severe asthma. Some have a sensitivity to aspirin or NSAIDs like ibuprofen. If your allergist diagnoses you with this condition, first-line treatment is usually saline rinses and a corticosteroid nasal spray. Now, that corticosteroid nasal spray can reduce the inflammation and swelling in the nasal passages. Sometimes a short course of oral corticosteroids can be used to shrink the nasal polyps, but keep in mind there's a risk of severe side effects if this is done frequently. These medications should never be taken long-term for this condition because of side effects. For patients with moderate to severe symptoms, the most common medical treatment are biologic medications. Now, biologics treat the source of the symptoms at the cell level. In fact, they control inflammation that causes sinus problems and the development of nasal polyps. In fact, they can help shrink the size of the nasal polyps. If these medications do not help, your allergist may recommend surgery to remove the nasal polyps. This can help open up the sinuses and make nasal medication work better.